Hello and welcome back to the latest episode of Marxist Voice, the podcast of socialist appeal, the Marxist voice of labour and youth. Now, last week we spoke to Natasha, a comrade in Sheffield, who's a teacher and an NEU member, and she discussed with us the situation about schools and education. And now tonight we're going to be talking about the situation inside the NHS and the healthcare system. We're going to be joined by another essential worker, Raj, who's a junior doctor and a BMA member in one of the most hard-hit hospitals in the country, down in the southeast of England. It's going to remain anonymous for tonight because, unfortunately, doctors have been punished and faced disciplinary pressures for speaking out during the pandemic about the conditions inside the NHS. So he's going to be joining us just via audio call for tonight. And Raj is going to be speaking to us about the situation inside the NHS at the moment, which is really facing its deepest crisis since its foundation after the Second World War. So thank you very much, Raj, for joining us tonight. Can you hear us okay?
I can hear you. Thank you for having me.
Yeah, well, thank you very much for joining us. I know that obviously all NHS workers must be extremely busy right now, out on the front line, dealing with patients, working incredibly long hours. And really, it seems like the NHS is only being kept alive at the moment, being, kept afloat by the tireless efforts of doctors, nurses, and other NHS staff like yourself, this incredible dedication and sacrifice. So thank you for taking, your very valuable time to speak to us tonight. There is, as I said, really the biggest crisis the NHS has ever faced going on right now. It's extraordinarily alarming to hear about the dire situation inside UK hospitals. A lot of healthcare officials in the press have talked about the NHS being at breaking point. Can you explain for our viewers about the scale of the problem and try and illustrate just how bad things have become?
I think it's quite difficult really to describe just how chaotic the situation is. There were some figures that came out today saying 1,200 deaths. That's the second highest number of deaths in a given day since COVID, the outbreak first started. I think that's sort of having disastrous effect on our ability to care for our patients on the wards. I've been told regularly that I can't send my patients to ITU because they don't have capacity for anyone who's severely unwell. On my ward itself, 1 in 3 nurses is off sick with COVID. I think it just goes to show, and that's just obviously on a small scale, but my hospital, the whole NHS is really struggling with what's going on. And I think this is on a much worse scale than any winter crisis that we've ever had to face.
And we're not even really at the peak of this crisis yet, are we? How much worse can it get? How much worse will it get in the coming weeks?
I think that's a question that a lot of staff are asking themselves. How much worse could it get than it already has? But yeah, that's right. So I think the current projections right now are that it's going to reach its peak in early to mid-February. But to be honest with you, I think staff are struggling to even manage with the levels of stress and the demands on the NHS right now. I think we'll obviously see a lot more deaths, a lot more cases, but it will have a ripple effect on services that we provide to even patients who don't have COVID, who are already waiting longer times to have scans, even to have simply their pain medication administered, because nurses are so overworked with all kinds of tasks brought up by COVID. So I think we're all sort of dreading how much worse this can get.
They've talked about 5,000 or so bed shortages across the whole of London, for example. As that's many hospitals worth of beds, obviously without the staff to actually man all these patients and look after all these patients. So can you explain then really, what do those numbers translate to in concrete terms? What does the situation look like for workers on the front line in terms of their conditions and importantly for patients, not just for COVID patients, but all of those who require healthcare right now?
Yeah, I think the NHS is completely overwhelmed, and I think in a way that it doesn't really compare to anything in the past. we're barely supporting the COVID patients as it is. In some hospitals, they're having to almost ration the amount of oxygen levels that they give to non-COVID patients just to make sure that those who have COVID get enough to survive. They've had to sort of alter their expectations and their targets because of the fact that we don't have the resources to meet the needs of these patients. And with that in mind, there's no sort of capacity for treatment for other conditions, for other patients. So on my ward, there's been a lot of apologising to patients and saying, sorry, you can't have your scan today because we're going to have to give up the CT department for example, scanning of COVID patients. And then, the cleaning measures and so on that come with that mean that patients are having to stay longer in hospital, which puts them at further risk of developing COVID and other infections. And, it means that the sort of burden of essentially the COVID pandemic is affecting a lot more people than I think a lot of people expect it to.
Thank you. Yeah, thanks for outlining that. And just to say to the viewers at home, if anyone has a question for Raj they'd like to ask, or a question for the show in general, please do send them in on Facebook or YouTube, and we'll try and get to those later on. Now, Raj, just going back to the situation, the Tories obviously have tried to push a narrative, particularly in the last couple of weeks, that all of this, in terms of the lockdown, the crisis in the NHS, they're blaming it all on this new variant, this new mutation in the coronavirus, which has made it much more infectious. That's clearly a scientific fact. But what is the real situation in terms of this NHS crisis? Was it created overnight simply because of this new mutant strain, or are there underlying weaknesses that have really been exposed by the virus?
I think this new strain, infectious as it is simply an excuse to justify, the way that the NHS is struggling. But I think anyone who's worked in the NHS, or even when I was a medical student, sort of shadowing doctors on the wards, it's been very clear that this has been a long time coming, and that even without the COVID pandemic, the hospitals would be struggling a lot as is. Tory austerity has been absolutely brutal, not just on patients in hospitals, but also on GP clinics, on community, physical and mental health services. So, since 2000, there's been a 30% drop in bed capacity in the UK. And, this is just completely bananas, because at the end of the day, we've got an aging population, we've got a growing population. Why would we possibly ever want to cut the amount of beds that we have? And yet we do. And in doing so, it's driving away staff. It's pushing them to breaking point. And we saw that in the Nightingale's hospital, where despite building this big, beautiful hospital, you couldn't get the staff to man it. So it was a complete waste of resources and money that could have gone towards supporting patients in hospitals and in the community. So I think it's very easy for them to say that this is all because of this new variant, but the NHS has been on pretty shaky foundations for at least a decade now, if not longer.
And just how bad is the staff shortages? How many people have been leaving the NHS in terms of nurses, doctors, other staff over the last few years? I mean, you're a junior doctor. I remember the junior doctors waging quite a militant struggle in 2016 against Tory attacks on their conditions, and that presumably must have driven a lot of people out of the profession. Then the nurses have had their bursaries slashed and taken away in many cases, and pay has been frozen for a lot of NHS staff. So, what's the cumulative effect of all these Tory attacks on staffing levels?
Well, I suppose, in terms of driving people away, as it were, there are a fair share of junior doctors who, are unhappy facing the sort of brutal conditions we're under. And a lot of them do end up going to Australia and New Zealand, for example, or to the States, where doctors are treated slightly better, as it were. But I think, touching on that nurses' bursary issue, it's also really important, because actually we're not getting enough nurses and doctors coming into the NHS. And, partly that's because, doctors used to be this sort of, relatively well-off profession, but it's becoming increasingly, made into a sort of a working class profession without that status, without the security that came with it. And nurses have been, for decades exploited. These nurses' bursaries that are being removed means that people are unable to sort of take on that university debt. And so, I was reading the other day that 1 in 10 nurses spots in the NHS are empty. we've got at least a 10% shortage. I think it's probably a lot more than that. And like I said, you can see that in the Nightingales, but you can see that on any given day or night in the wards, where you have not enough nurses to cover way too many patients. And all it means is that you get nurses a lot more exhausted than they should be. And I think, no one really wants to talk about that as a sort of inconvenient truth behind a lot of the issues in the NHS, understaffing.
And what about the cumulative impact of privatisation and outsourcing? And you've had things like the Lansley reforms that were brought in earlier last decade, and then, a cumulative privatisation from not only the Tories, but New Labour before that. What kind of impact does that have on being able to coordinate the NHS and the response to the pandemic?
Absolutely. I think, again, privatisation is its big issue facing the NHS. I was actually just on one of my hospital's private wards today, and something as small as the fact that they don't use the same intranet system as us really delays the way that we can manage care. And it might sound like a small thing, but these sort of small things accumulate into big issues. So, I was chatting to a nurse on the private wing, and I said, "What do you do when you have a COVID patient?" They said, "Oh, it's easy. We just pass it on to the public sector beds, as it were." So I think, in that sense, that's not really a reliable or stable way of delivering healthcare if you're doing it just for the sake of profit and not for patient clinical outcomes, which is what the NHS, or rather the public sector, does. So I think, and we also know that hospitals are often built on private money through these, I think, private financial initiatives, I think they're called, the PFIs. And so that means that hospitals are constantly sort of drowning in debt, and that encourages them to cut resources wherever they can. Impacts on not the management, the staff.
Yeah, and presumably, meanwhile, the management consultants are all getting a nice cut of all of this money as well, this taxpayers' money. So I'm sure they're not suffering at the present time, or have unlikely to have been suffering at any point, all these big business management consultants. But just to go back then to this question of the staff shortages and the conditions inside the NHS, what does all of these pressures mean in terms of the conditions for NHS workers now? Not just at the current time, but even since the beginning of the pandemic. It's some of the images from inside hospitals of staff having to kind of make their own PPE, and doctors and nurses being kind of gagged from speaking out against this. It's really quite shocking stuff in terms of, it feels like it must be like a war zone on the front line. Is that how it feels from your perspective and from that of your colleagues?
Yeah, no, definitely. I think it's a sort of protracted war in that everyone is just sort of facing this unrelenting exhaustion. So, just last week, the nurses on my ward, well, I think nurses in the hospital, were told that their annual leave is probably going to be cancelled. And, you realise that this is partly to do with the shortage of nurses and the need to fill the rotas and so on, but partly it's just an indifference to the suffering of the people on the wards. And I think, there's this whole sort of, lit spirit type thing of, keep calm and carry on. And that was fine during, maybe the first week or two of the pandemic. But by now, there's very, very regular cases of burnout, people just really, really struggling. And that has an impact on patient care because, when I'm tired after a long shift, I'm more likely to make mistakes. I'm more likely to not pick up on small things that could really help my patients recover. So, it's not just a war on the NHS, it's on the general population and their ability to, survive conditions that, in a properly funded NHS would be sort of a lot easier to manage. There was a survey by the BMA, the British Medical Association, my union, earlier in the pandemic. It showed that 44% of doctors who responded to the survey have started to suffer from depression, anxiety, stress, burnout, or other mental health conditions exacerbated by COVID. I think, that's just startling that almost, 1 in 2 doctors is mentally struggling, to really even wake up in the morning to come to their job. And you see that in the exhaustion in the wards.
Well, I mean, you've actually ended up answering a question from the audience. Dylan in Sheffield asks whether this disaster mode is starting to erode the quality of care offered that can be offered by staff, and also what health toll this is having on NHS staff itself. It seems that you've answered that second part of the question already there, really. But going back to that first part, then, you know, what is the impact, this long-term kind of struggle that staff are having to wage, the long hours, you know, what toll does that take in terms of the ability of NHS staff to be able to offer decent quality care? You know, what does it look like from a patient's perspective?
Well, yeah, like I mentioned before about, you know, something as simple as pain medication. Patients who have sort of long-term pain will need their medication roughly at set times, and often they'll sort of come out of their rooms or come out of their bays to the sort of reception desk saying, "Can I really have my pain medication, please? I'm really struggling." And, you know, often we have to say, "Sorry, we're really busy with something else. We'll get to you as soon as possible." And I think, you know, even something as well, not small, but as routine as that sort of builds up, and so patients are leaving hospital later than they should do. They're sometimes being left to sort of have to come back for a follow-up because we need those beds so desperately because of that pressure from the top. And I think, yeah, and that's the sort of impact that it's having on patients, is that they're not getting the, you know, high quality healthcare that the NHS was set up to provide. And I think that's just devastating, and it makes it difficult to come in the morning knowing that I can't be the best doctor I can be because of, you know, forces outside my control, because of a decade of austerity and a government that really doesn't care much about the so-called health heroes that they clapped for earlier in the pandemic.
Definitely. And you're obviously looking forward in terms of, you know, how to get out of this crisis. It seems in the short term, obviously, the key thing is for a real lockdown that's going to actually reduce case numbers, reduce infections. It seems like even here, though, the Tories obviously are trying to shift the blame. You've seen them, you know, in the last few days in particular, saying that people aren't following the rules and following the guidelines, even though Boris himself is obviously breaking guidelines, you know, cycling off to the other side of London rather than sticking in Downing Street. But it seems like, you know, here, really, again, it's the Tories trying to shift the blame from the fact that they are the ones who dithered and delayed bringing in restrictions and lockdowns. And even at the moment, it seems like really the main problem is that a lot of businesses that weren't open the first time round are now open, have been reclassified as essential. So there's a lot more workers having to go into work. There's a lot more people on the streets, you know, doing things that are perfectly legal according to the rules. But, you know, basically the government is giving a free hand to big business to go about, you know, trying to carry on making their profits. So it seems like, again, the Tories are blaming everyone but the real culprit, which is themselves and the bosses. But I just want to look a little bit further ahead than that. Obviously, the real solution to this is not just endless lockdowns, but the vaccination program. And, you know, what is the perspective from inside the NHS about this vaccination program? What are some of the key problems that the country faces in terms of trying to roll out the vaccines as quickly as possible?
Yeah, I think a lot of my colleagues are really excited when the good news came that, you know, the vaccines had been approved and that they were basically good vaccines. And I think with that excitement, it very quickly turned to frustration because, you know, it was just an absolutely chaotic rollout. So, you know, I'm speaking to my colleagues across and my sort of old uni mates who are now doctors across the country. And, you know, you're getting all kinds of weird stories of, you know, for example, administrative staff getting vaccinated before people who work on the wards. Or, you know, the fact that I was speaking to a cleaner today who said that they've only been approved for vaccinations from next week. This vaccine's been knocking about since at least December, if not earlier. And, you know, there's just these constant barriers to actually getting a vaccine. No one has emailed us to tell us how to get a vaccine. It's only through word of mouth. We've only found, you know, the secret phone number that gets you access to the vaccines recently. It's for my hospital, it's a 1-hour drive to get to the nearest vaccine site. And if you're a nurse on a 12-hour shift, I mean, you're lucky to be able to drive home in one piece, let alone to go to another hospital to pick up the vaccine. So, you know, I think it could have been done very easily. And I think, you know, I speak to a lot of my colleagues and we sort of agree that, you know, if you gave us an Excel spreadsheet and you gave us control, we'd probably do a better job than these so-called bureaucrats and stuff who've just really scuppered it. And, you know, that's going to have effect because, you know, I think they're saying that over 2 million people have been vaccinated with the first dose. but only about 400,000 with the second dose. So, it's all big headlines and so on, but actually on the ground, not enough of us are getting vaccinated. And even when we are, it's not sort of to completion. So, yeah.
So what do you think are the solutions then going forwards? What would a socialist Labour government do in this situation?
I mean, in terms of the vaccines themselves, even before they start to be distributed with these sort of issues with the supply chain, it's very straightforward. Just nationalize the pharmaceuticals. I think it's ridiculous that there's a profit mechanism in life-saving medication, whether it's a vaccine or any of the other drugs my patients take on the wards. So once you've nationalized the big pharma, we need to always have a massive drive for volunteers led by the trade unions and sort of community organizations and a massive vaccination program. And workers need to be leading on this. It can't be these management bureaucrats who sit behind a computer all day earning a six-figure salary. It has to be people who understand the need for vaccines. So I think, it would be a coordinated, centrally planned thing as opposed to the sort of chaotic, patchy coverage we have under the Tories with vaccines that, often aren't even getting to the countries that have ordered them. So it would be a lot more organized and it would be a lot more transparent. And I think it would probably save a lot of people who've probably died avoidable deaths because of this sort of inefficient rollout of the vaccines.
Definitely. And I think then looking beyond the vaccines, even in the long term, as you said, this crisis in the NHS wasn't created overnight. It existed before the pandemic and it'll exist after the pandemic as well. We've had an interesting comment from Siobhan in London, who's pointed out that the Tories have used every kind of problem inside the NHS, every crisis, they've used it as an opportunity to actually attack the NHS further and to make the case basically that public healthcare doesn't work, that we need the market as a solution. So clearly there's going to be big battles even after the pandemic to save the NHS, to repair the damage done from the pandemic and to try and rebuild and move forwards. So, what are the solutions in the long term to the NHS? I mean, I remember it was only a few years ago, the Red Cross, I think, declared the NHS to be in a humanitarian emergency in terms of, patients kind of lying in corridors and things like that. So, clearly the NHS has already been overstretched and things are only going to be worse in the years ahead, even after the pandemic. So what does the Labour movement really need to be fighting for? It was the Labour movement that created the NHS in the wake of the Second World War. What does the Labour movement need to be doing now to save the NHS, to save our NHS?
I think, first of all, we need to make sure the NHS is our NHS and not bit by bit becoming the NHS off, these private sector parasites and so on. So it needs to be under public ownership. But even if it's under public ownership, we have to really define who the public, as it were, is. Who is the government that's running things? A nationalised NHS under the Tories doesn't really mean much because it's just being torn apart by these sort of piranha-like parasites, as it were. So we need to, renationalise, as it were, the private sector elements. So all these wards that have been created on private money, you need to wipe off that debt and say this is healthcare for the people. You need to, like I said before, sort of nationalising big pharma, but also the care homes in the community that are often sort of, using exploited care workers to provide subpar care because they need to find a profit mechanism somewhere within it. But it needs to be under the control of the workers. And I think there needs to be these sort of worker committees made up of the people who work on the wards, the doctors and the nurses, but also the healthcare assistants, even the porters and the cleaners, the people who genuinely understand how a hospital works to run things. It can't be, like I said before, these bureaucrats on a six-figure salary who often are really out of touch, and they send us emails saying you're doing great, keep working hard, and so on. While they don't really add much value to patient care. I think also we need to fill the ranks. I mean, the massive recruitment drive, and to do that, we need to make sure that people aren't afraid of the university debt that comes with becoming a nurse or a doctor, and you need to make sure that they're being paid fair amounts, so no one feels like they're being exploited on the wards. There needs to be an increase in pay, but also an increase in workers so that you have that workforce that can provide for patients. And to do that, we need to have a fighting force of socialism in the Labour Party and the trade unions. This needs to be an active effort, and it needs to be a coordinated effort. So unions like the BMA and the Royal College of Nursing, just to give a couple of examples, need to be a lot more militant in what they demand. And it's not enough to just sort of nip at the government's heels to make radical demands of the Tory government and a radical plan for the future. So I think none of this is difficult to achieve, but it needs to be done in an organised way. And I think the only way to do that is with a programme of bold socialist demands. It's not enough to just complain about it, but you have to move and act in order for this to be achieved.
Thanks, Raj. I think that's a really important point to end on for tonight, really, which is that this is not only a public health crisis we're going through, but a political question that ultimately requires a socialist solution. So I think you're 100% right. The Labour movement needs to be arguing for bold socialist policies to save the NHS. And thank you really for joining us tonight to outline what that would look like and to give us a very graphic picture of what's going on inside the NHS at this time, the catastrophe that is facing NHS staff and patients and the whole country, really. So thank you again for taking the time to join us. And obviously wish you the best of luck and solidarity in the work that you're doing. Obviously, all of us here and at home will be fully behind NHS workers, not just with claps, but with political demands, supporting with genuine solidarity, fighting for better pay and conditions. As we say, claps don't pay the bills. So thank you very much again for joining us.
Thank you.
And as Raj said at the end there, the important thing really is if we want to save the NHS, we need to fight the Tories and get rid of the private parasites. And that means struggling for socialism. So what we want to say to everyone at home is that if you've agreed with what Raj had to say tonight and you want to help support us in the struggle for socialism, then please, of course, not only like and subscribe the podcast, the videos, and share our articles, but please visit socialist.net/donate and socialist.net/subscribe, where you can donate to Socialist Appeal and subscribe to our digital paper, which is still being produced even in lockdown. And of course, if you haven't already, please get in touch at socialist.net/join in order to actually join us in the struggle for socialism, to get involved with other Marxist activists in the fight for socialist policies, to save the NHS, to fight the Tories, and to bring in a socialist transformation of society. So please do that. Please support us. Like and subscribe the podcast and YouTube channel. And we'll be back soon with more interviews, more theory, more analysis, more history and current events, all brought to you by Socialist Appeal, the Marxist Voice of Labour and Youth. Thank you very much. See you next time.